Hello friends, I am Dr. Vimalendu Brajesh and I am the Director of Plastic, Aesthetic and Reconstructive Surgery Department at Medanta Super Speciality Hospital, Noida. And this video is going to be an informative video where we are going to talk about how to manage a burn sustained at home. And this is a very common type of burn and which happens in day-to-day life. And a lot of patients come to us with the scald burn, with the blister over the hand or over the face, and these are usually sustained, and mostly it is in the winter days where you tend to have a bath with warm water. So the first and foremost thing we would like to talk is how to manage that burn. We will also talk about what are the myths associated with these type of burn. We see patients on regular basis who have certain notions about the management of burn which is medically not correct. So first and foremost myth that comes with the management of burn is that the moment you have a burn, apply ice. And let me tell you, this is a very myth which is completely very deeply embedded in the thought process of the people. So let me tell you, no ice application is advisable. What you need to do is to put running water, part which has got burned, where the hot water or beverage has been spilled. Just keep that part under the running tap water for at least 5 minutes. The purpose of this is twofold. One is if there is anything which is in contact or contaminated, then it gets washed off. And second is that the temperature of that part falls down. So the burn which may have been a deeper burn will not convert into a deeper burn, and it will remain a superficial burn. That is the first and foremost thing. The other thing is that whatever clothing is in there in contact, immediately try to remove that part. Even if you have to cut it open, that is fine. But that clothing should be, so any hot thing, the contact period has to be reduced, number one. And number two, it should be washed with only plain water, nothing, no cold water, no ice, only running tap water is what is needed. Next myth is that you should be applying Borolene, Boro Plus, or some turmeric or some Lukmane ka oil and all those things. So nothing is recommended. Let me tell you, whenever you apply anything, what happens when you report to a doctor, then because of the color of the ointment that you have applied, it becomes very difficult to identify the level of or the depth of injury. So we have to painfully remove all those whatever you have applied, and it is a painful procedure. So better not to apply anything and first report to a plastic surgeon who is the specialist for the management of burn. Now here when we are talking about burn, we are not talking about extensive burns or very deep burns. We are talking about those burns which are sustained in day-to-day life, doing various activity like cooking or taking a bath, sip of beverages, hot tea or coffee. The other myth associated with the management of burn is the use of dressing, whether we need to do a dressing or not. And we have found that there are a lot of people who think that burn, it should not be dressed and it should be managed in an open dressing. Let me tell you, open dressing does not allow the burn to heal properly. And what happens, you are actually predisposing the burn for multiple contact with the external environment and allowing to get infected, which may convert a otherwise superficial burn to a deep burn. So therefore, any burn should not be managed in an open dressing, rather, unless it is a very superficial. Once there is a blister formation, it should be managed by a closed dressing. That should be the protocol. And when we say closed dressing, let me tell you, there are so much advancement in the dressing material that nowadays whatever dressing we apply, we don't need to change that dressing every day. We apply the dressing and then allow it to stick to the wound, and once the wound heals or the burn heals, then only that dressing peels off by itself. So it's a completely painless procedure where the dressing once applied, we don't need to change it every day. So another myth which is associated with the burn, there is one set of people who say you needed to keep it open, and there is another set of people who want to do the dressing every day. Let me tell you, both of the process are wrong. You need to do a dressing, proper dressing at the first instance, and then you have to just monitor that dressing. You don't need to change that dressing. So this is another myth which has to be busted. And the fifth myth that is associated with management of burn is that you need to have some sort of antibiotic. And many a times the patients come to us and they frown at us, Dr. Saab, you have not written any antibiotic. So let me tell you, antibiotic in cases of superficial burn or any burn which has been managed primarily, you do not require antibiotic. And by giving antibiotic, we're actually making it susceptible to resistance to that antibiotic. So a burn wound, if managed properly with the first dressing, primary dressing in a proper way, you don't need any sort of antibiotic. An antibiotic is only needed if you have a proven infection. So if you immediately report to a surgeon, you will definitely not require any antibiotic. So these were the important myths and how to manage or you can take it as an advice, how to manage a burn wound, superficial burn wound, how at home setting. That's all from my side. Thank you very much.